It is important to identify the best IT infrastructure in preparation for a reliable electronic environment. You should be focused on meeting the unique needs of each practice by providing a proper assessment and thorough evaluation. Experience over time will help you to more rapidly execute these steps. However, as a medical practice performs critical daily functions utilizing this technology, it is important to provide cognizant consulting for each and every new client. Medical practice and clinical environments have many options for IT infrastructure. As with any small business, it is best to establish with these sites how they plan to utilize their technology. However, medical environments are different on many levels, and critical questions should be asked prior to assisting a practice down the path to best EHR infrastructure. Establishing a baseline for future discussions and narrowing the field of choices on both the hardware and software sides is an excellent beginning. First, ask these questions. 1. Will the practice select a subscription or client-server EHR PMS licensing model? 2. Have they already selected or been assigned a solution by an affiliated hospital? If so, which solution? 3. Are they migrating data from a legacy or custom solution? 4. Do they currently own a server for data or IT operations? 5. Do they have satellite locations? If so, how many? 6. Do all staff who require a workstation have one? 7. What existing technology do they wish to maintain or evaluate for upgrade? How many units currently? What is the age of the units? 8. Will the site require upgrades or replacements to peripherals and attached devices? 9. Do they have the physical space and budget to improve or install a server-based network? 10. Is the current broadband on site sufficient for either client-server or software-as-a-service model? 11. Do they have a wireless network in place? Is it HIPAA compliant? 12. Is there a staff member familiar with or assigned to support technology on site? 13. Are they currently working with an IT group that is not versed in medical technology? 14. Do they have or maintain a technology inventory of their systems on site? And 15. Have they created a list of current user passwords and login information? After this list of questions has been answered, you may move on to the IT assessment step. A good first step is to establish a baseline of current status, which the HIT community refers to as an IT assessment. Executing a comprehensive assessment of current technology on the site can give the consultant a picture of the technological proficiency of the staff, a framework for upgrade and replacement needs, reviewing existing technology on site, an inventory of specifications for vendor requirements, an opportunity to identify areas of weakness in security and broadband speed, a good baseline for future recommendations, planned maintenance, and disaster recovery planning. After a practice has decided to investigate the costs and options associated with EHR solutions, you begin by submitting a baseline report request. Then, you may execute a more complete IT assessment. A solid network assessment tool is needed to establish a baseline of technical specifications. An additional manual form is used to capture non-network content. A report is then generated which must be summarized and attached to a proposal. The proposal should clearly outline necessary steps to best IT infrastructure changes to prepare for an electronic record environment. Another important early step is to discuss options with the practice regarding the platform for electronic records. With hundreds of potential options on the market, one quick way to narrow technology choices is to establish dedicated physical space and technical expectations for the practice. Do they plan to buy licenses and host their own data on-site in a local server? Buy licenses and pay to have their data hosted by a third party? Purchase subscription licenses and pay monthly for hosting by the vendor? The answer to these questions can guide all future conversations. After the planned platform and existing status are established, the consultant can consider the various technical possibilities. EHR specialists should be familiar with the installation and implementation of the following hardware and software components as they relate to proper infrastructure. A solid understanding of EHR workflow, HIPAA compliance, and IT assessments will help you guide any ambulatory environment through to the best available technology. Each EHR vendor maintains a list of IT requirements to support their specific solution. This list is an imperative read prior to evaluating and suggesting specific technology to any practice. Obviously, the many questions answered during the initial evaluation and assessment period will weigh heavily on recommendations and the vision for that environment. However, the requirements specific to the selected product will require review before creating a final quote or beginning to create the appropriate infrastructure. Several of the components will be similar from vendor to vendor, though in some cases specific products and even brand names are required to operate certain solutions. Always consult the most current, vendor-specific technical requirements document prior to engaging in the technology selection step. A rack or tower server may be the backbone for client-server EHR solutions and may also be used for fax server functions and for data consolidation and backup. In addition, some sites may utilize a small server for local data synchronization, even if they are subscribing to a solution. If the practice is using software that operates under a client-server model, it will be required to have a server that meets the EHR vendor's minimum requirements. Servers generally fall into two categories: web-based and client-based. While web-based virtual servers tend to be less costly, a client-based solution may be more reliable. Depending upon the size of the medical environment, a simple tower-style server or expandable rack or blade type may be considered. Multiple servers that separate data from operational software and fax functions may be required by larger vendors. This approach protects the data and permits faster and more efficient operations. If accessing data from a local or virtual site server, dependence on that server is critical, so it is vital that this equipment is carefully selected and configured to meet vendor guidelines. Backup solutions should be discussed at length with the practice. A dual local and online remote solution that permits redundancy protection is recommended. The network in a practice environment may connect a server to independent workstations, one computer to another, all units to the internet, and ultimately to the EHR data and system software. All medical environments will need a reliable internet service provider, or ISP, and a high-quality, secure network. If the practice will use wireless tablets, laptops, or mobile devices, a secure wireless network is important. In some cases, such as where physicians are planning to do a significant amount of interactive communication with patients and across the network with sensitive data, additional protections, such as enhanced security solutions, may be employed. A comprehensive understanding of security and privacy issues related to electronic medical data is imperative for the HIT consultant. Another contender in the tablet market is the smaller, lighter pad unit. A variety of handheld devices have been introduced, and there are applications that have been designed to work seamlessly with many of the major certified ambulatory EHRs. These units are smaller and lighter than the standard EHR medical Slater tablet, but they are intended to provide some of the same features and functionality at a lighter weight and lower cost. Some will fit easily into the pocket of a lab coat. One of the benefits of these solutions is their portability. Many incorporate the use of cellular internet functionality, allowing medical personnel the freedom to access tools while in transit to and from the practice. Again, the HIT professional must ensure that such hardware is properly equipped and configured to meet HIPAA regulations. Workstations, desktops, and slim clients can be used in conjunction with tablet PCs and laptops or on their own in each treatment room. Because the standard workstation is a relatively uncomplicated and inexpensive technology, many offices choose them for their cost efficiency. Workstations are often an ideal option if an office has many providers but few treatment rooms. In this scenario, the office may not need to equip each provider with a personal tablet PC or laptop. Workstations can be housed in powered medical carts to permit greater mobility in the exam rooms and around the practice, and they can be paired with medical touchscreens at higher resolutions for greater flexibility and functionality. All-in-one desktops can save space and are reasonably priced. All-in-ones house all components interior to the monitor, as opposed to requiring a separate tower and display. Some even have touchscreen capability, similar to the digitized tablet, but at a lower cost to the practice. In growing numbers, medical environments utilizing workstations for cost efficiency are opting to pair them with medical-grade displays. These displays provide a number of benefits, including higher resolution for use with imaging scans and their washability to reduce germs and help promote an antimicrobial environment. These displays are generally custom-built with brand-name display units overlaid with washable and touch-capable veneers. They are functional while wearing surgical gloves and have been designed to withstand medical environment challenges. These displays may cost a bit more, but they are often well worth the added expense. Standard laptops are mobile, but may be lower in cost than a full-touch tablet. Laptops can also be placed on non-powered rolling carts, providing convenient mobile access while permitting the user to have their hands free. Low-end laptops are not a good selection for practices, as they often do not meet minimum specifications by the vendors for operational use of the EHR software. Careful selection of traditional laptops and desktops is necessary to ensure compatibility. Imaging devices, mainly workgroup and ID scanners, help make the transition between paper and electronic documents easier. Workgroup scanners for the medical practice must be Twain compliant, should have robust pages per minute scan capability, and be capable of relatively high volumes. Despite the move to electronic functionality, medical practices are often still required to do scanning into the electronic record. At least one high-volume workgroup scanner should be a part of all new EHR practice assessments. ID scanners can be used with many of the major certified solutions to automatically scan driver's license and insurance information directly into the patient record. This functionality can reduce the amount of information that must be typed in manually at each new appointment. Several even permit the population of the ID photo into the record for quick patient identification. Technology that allows practice staff to spend more time focused on patient care and less time addressing tedious clerical duties can help improve workflow efficiency. Most EHR vendors also suggest at least one reliable, high-volume laser printer in each practice. Again, paper printouts remain a part of medical practice even in environments that have transitioned to EHR solutions. Multifunction devices that have print, fax, and scan capabilities are cost-effective options for locations where only limited scanning will be done. They make excellent additional scanners and can double as secondary printers as well. For the initial implementation phase, high-speed, high-volume scanners can often be rented to handle the heavy scanning of initial patient records into the electronic system. Most EHR vendors recommend at least one print-only, networkable laser printer be available for heavy print duties and at least one scan-only workgroup scanner for daily scanning tasks. The rapid increase in cross-contamination infections is a critical problem in healthcare. Direct contact with medical equipment, input devices, and other hard-to-clean surfaces poses a significant challenge to infection control efforts. For example, studies have shown that computer keyboards can harbor up to 400 times as many bacteria as a typical toilet seat. Therefore, encouraging practices to upgrade or swap direct contact items, such as keyboards, mice, and monitors, with antimicrobial equivalents is an excellent way to improve the technical environment. Several vendors design and supply these accessories. Medical devices that connect to EHR technology will save time and reduce opportunities for transcription errors. Common devices that can interface with an EHR include ECG machines, holster recorders, digital scales, and vital sign monitors. An interface for these devices may be required by the EHR vendor at additional cost. Radiology equipment and services can also be linked with the EHR system. As mentioned previously, carts are an excellent tool to provide a practice or clinic with added flexibility for their workstations and medical devices. They are ergonomically designed, allowing both seated or standing operation. They provide mobility and also enable the use of single workstations in multiple locations in the office, saving both money and overall use of space. Carts are designed as powered to host workstations or non-powered to support laptops and other medical devices that operate using their own long-life battery. Another product that many practices find invaluable is a patient portal or kiosk. This service provides practices with portals for patients to fill out electronic intake forms, verification of demographic information and insurance eligibility in real time, and collection of balances and copays immediately via credit card. All patient information is then securely stored for easy access. With an additional interface, many can import that data directly into EHR records. Some are tablet-based. Other solutions are provided by the bank and involve small payment verification devices. Still others may be linked services available via patient portals and the EHR system itself. Check with the specific vendor selected for this project to review the various options and benefits of each. There are a number of different hardware and software products available to help facilitate ease of use for many EHR solutions. These products and services can greatly increase time and cost efficiency while providing expanded patient care and payment collection services. One popular time saver is voice recognition technology, which allows physicians to edit a patient's chart by speaking into a headset, microphone, or dictation machine, converting speech to text. Many of the certified EHRs permit the voice activation software to assist them in navigating menus within the software. Some are built directly into the EHR. Others may be attached and configured to work with both navigation and text input. Whether the practice is moving from a paper or a legacy system, manual or staff entry of data can be cumbersome and time-consuming. Often, a practice will look for an outside service company to provide either high-speed scanning of paper documents into the EHR or to convert legacy EHR system data into the new system.